Well, good morning, everyone. Good morning. Again, my name is Giles Willett, and I'm the owner and sole proprietor of Bay Park Senior Insurance. I've been doing different forms of Medicare insurance for the last 20 years. Prior to that, I ran a company that, well, people that are over 20 years old have heard of the Mainline Bus Company. I think years ago, actually, people from Fame actually hired the buses. So, um, but as their general manager of the bus company, I handled all of our benefits. So technically, I've been in health insurance for over 40 years. So, um, and what I do, I don't work for any government agencies. I don't work for Medicare. I don't work for Main Care. I'm an independent insurance agent. I'm licensed in insurance, health, and life. And I assist people right from the beginning of the process because when somebody, the two ways to get Medicare are you turn 65, or if somebody gets disability, and from the time they start their disability, they have 24 months a waiting period, and then they get the same Medicare that a 65-year-old gets. So, but when people approach that age 6 months prior to them turning 65, people get bombarded with all kinds of mail from insurance companies because there's ways companies have of finding out. There's lists of people who are turning 65. So, and to give you a little bit more, I'm actually on Medicare myself. I started January 1st, turned 65. I know I don't look it, but um, it's great. I for the last 2.5 years have been looking forward to turning 65 because I could get Medicare, have good insurance, and actually had my right knee replaced in January. And it was great having really, really good insurance. Um, so I'm going to go over the parts of Medicare this morning, how it all works. When someone approaches 65, they have a 7-month window, and the 7-month window starts 3 months prior to their 65th birthday month, the month of their 65th birthday, and 3 months after their birthday. So that's the 7-month window that people can enroll. Now, there's a lot of what I call misinformation out there. There are, even coming from the government, there's things that come out from Social Security that say when you turn 65, you must enroll in Medicare A and B. Well, what it should say next is unless you have group coverage. But unfortunately, it does not say that. So people call me up in a panic sometimes the month before their birthday, because if you're born in a month from the 2nd to whatever the end of the month is, the 30th, 31st, then you are eligible for Medicare the 1st of that month. If you're born on the 1st of the month, you are eligible for the prior month. So if you're born April 1st, April Fool's Day, you get the month of March. So it always starts on the 1st, no matter what day you're born during the month. So I actually have a slideshow that I'm going to pull up here. It's relatively short, but at the end, we're going to answer any questions. So write down your questions as I'm going along. And we'll, let's see here, share. Okay, here we go. There we go. So here we're going to talk about Medicare. Now, I want to caution people and tell you that Medicare only communicates with its beneficiaries 2 ways. The first way is with this book. It's called Medicare and You. And they send out a new book every month, but they only send out 1 per household. So if there is a couple in the household, one of them will get the book and the second one will not. About 5 years ago, they stopped sending it to each individual. I'm happy to see that there are young people in the crowd today, because some people say, well, I've got 20 years or 30 years before eligible for Medicare. But many of us help our parents and our grandparents with these things. Like, I have a 92-year-old dad, and he doesn't understand any of it, but luckily he has me to help oversee his medical needs. So as I go through this, we're going to talk about the parts of Medicare. What we're not going to talk about today is MaineCare, although I have a lot of knowledge about MaineCare, which is also in most states called Medicaid. It's mostly a low-income program, but we're not going to talk about that today. We're going to talk about the parts of Medicare, which start with what I call alphabet soup. The first part of Medicare is Part A, and it says hospital coverage, but what it really should say is inpatient hospital coverage, because A only pays if you're admitted into the hospital. So, and the $0 per month is the premium that you pay when you pick up Part A. Now, many people who turn 65 and are on group coverage will pick up Part A of Medicare because there's no monthly cost for it. The reason there's no monthly cost for it is you are paying into Medicare Part A now. When you're working, you have a Medicare deduction on your W-2. Now, some people can pick up Part A and keep their group insurance, and Part A becomes a secondary insurance. However, if someone is contributing to an HSA, you cannot enroll in any part of Medicare. And again, at the end, I'm going to give my number. If people have more questions about that, feel free to either ask me at the end or give me a call or send me an email, whatnot. So the second part of Medicare is Part B of Medicare, and that's the medical. That's basically everything to do except for inpatient in a hospital. If you go to a hospital for an X-ray or MRI, blood work, that's all covered under Part B unless you're admitted into the hospital. Now, the standard premium for Medicare Part B, everybody pays $148.50 per month, and most times that comes out of people's Social Security. Now, because Social Security doesn't always start at age 65, not everyone takes like myself, I was born in 1956, and my full Social Security age is 66 and 4 months. So I don't pay it through my Social Security. I pay it, they bill me for it. And usually they bill you quarterly. But the moment I start collecting my Social Security at 66 and 4 months, it automatically changes over to coming out of my Social Security check. And I say standard premium because these are means tested. So people with higher income levels, for an individual, 85,000, for a married couple filing jointly, it's 174,000. Over that, you pay more than the 148.50. The 148.50 can change annually. Normally, if they give you a cost of living raise in Social Security, then they increase the Part B premium. Just to give you an example, last year's premium 2020 was $144.60. So it went up right around $4 last year. Okay, so it can change. Then once you have Part A and Part B, and I actually assist people right from step one in enrolling in Part A and Part B. Now, when people go to enroll, you do not go to Medicare to do it. You go to Social Security. So you go, the website is ssa.gov. The reason you go to Social Security is they're the ones that collect that premium. So they're the ones that enroll you in Medicare. Once you're enrolled in Medicare, then you can go to the Medicare.gov website and gather more information or give me a call. The third part, once you have part A and or B, is you got to pick up a prescription drug program. That's part D of Medicare. That actually came into play in 2006. And I was already in the Medicare industry at the time. And these premiums for the Part D plans run anywhere from $18 a month to $95 a month, depending on what prescriptions you're taking. And the average cost of a prescription program is $40 a month. Now, I have numerous people who have got ready to go on to Medicare, and they said to me, Giles, I'm not taking anything for prescriptions. So I think I'm going to wait and pick up a prescription program in a year or two when I need it. And my answer to that is, then you're going to be subject to a 1% penalty for every month that you are not enrolled. When you go to enroll, if you waited a year, that's a 12% penalty. You wait 2 years, that's a 24% penalty. And it does not stop at 100%. I met with a 92-year-old lady about 2 years ago. She had 120% penalty because she never enrolled in Part D. She was paying for her prescriptions out of pocket. And unfortunately, she did meet up with me and no one else told her that she was subject to a penalty. In 20 years in this industry, I have never had a client who I met with and they then were subject to a penalty. I did, however, have met people who have had penalties before I met with them. And several of them I actually helped get out of the penalty situation because they were put in it. They were put in it on error, so that they didn't do it. Now, the fourth part of Medicare, which many people have never heard of, Part C of Medicare, is called Medicare Advantage. Like the prescription drug programs of Part D is a Medicare program administered by private insurance companies. Part C of Medicare is a government program administered by private insurance companies. There's 9 companies that currently sell Medicare Advantage plans in Maine. And as an independent agent, I'm able to license with any of those 9 companies that I want to. And I do a review of all those plans every September, which is just before the annual election period, which starts October 15th and runs to December 7th. You've probably seen the ads on television, okay? So you basically have 2 options when you go on Medicare. The first option is to pick up Part A. Now, Part A does have a deductible when you go in, when you're admitted into the hospital, even for just one night. The deductible is $1,408. Now, some people think that that's an annual deductible. It's not. It's good for 60 days. So if you go in the hospital for one day, say in February, and you come out, and then you pay the deductible, and then in April, you go back into the hospital, it's beyond the 60 days, you pay the deductible again. So some people could conceivably pay that deductible 3, 4, and 5 times in a year. So that deductible can be covered by a supplement, and we'll talk about that in a moment. Part B is the medical. Now, the deductible for Part B currently is $208, but that's an annual deductible. So you pay that once a year, and then Medicare pays 80% of your Part B charges, and you are responsible for the other 20%. That 20% is also another thing that people will purchase a supplement for to cover it. Okay? So then the prescription drug program. Here, You pay a premium, like I said on the other page, about $40, and then you have copays to pay based on the tier of drugs that you're taking. If you have preferred generic, that's tier 1. You might pay anything anywhere with tier 1 from $0 to $10 a month. Then you have tier 2, those are non-preferred generics. Tier 3 are preferred name brands, and tier 4 are non-preferred name brands, and tier 5 are specialty drugs, usually for conditions like MS and those type of things have specialty tiers. And those are a percentage of the cost, which can be as high as 33% of the cost. So now the part of the same option is to purchase a supplement. Now, they call it Medigap because it fills the gap between you and Medicare, meaning it pays these deductibles and co-insurances. Okay. Now, again, the confusing part of this whole thing when it comes to supplements is it's more alphabet soup because the supplements go by plan letters A, B, D, F, G, all the way to plan N. And a lot of people say, which one do I choose? That's what I assist people in doing. Plan F used to be the most frequently purchased plan. Many people have a Plan F, are grandfathered, but Plan Fs are no longer available for sale. And the basic reason is they cover the Part B deductible, the $208. And for whatever reason, the government doesn't want supplemental plans covering that deductible any longer. So most people nowadays choose a Plan G. And the Plan G through a company like AARP, United Healthcare, costs about $217 a month. So if you've been following along as far as the premiums I've talked about, you have the $148.50 for Part B. You have about $40 for Part D. And if you have a supplement, then that's another $217 approximately, depending on which company you go with. So that says that if your income is under, it's 87,000, I'm sorry, I said 85 earlier, it's changed. It goes up a little bit and it's been updated to 87,000. If you make under that, then your approximate premiums for the month is $400, which to me is a lot of money on with people who especially are just living, with Social Security. All right. So option 2 is to go with Medicare Advantage, which is what I did. I have a Medicare Advantage plan. My wife has a Medicare Advantage plan, and my dad, who's 92, has a Medicare Advantage plan. And it's entirely different than you have to have A and B. So you have to enroll in A. You don't pay a premium for that. You have to enroll in B. So you do have that $148.50 if you're under 87,000 in income. But the Medicare Advantage plan covers your hospital stays, covers your medical bills. Okay. So what it is you've got a private insurance company that's taking care of your claims in place of Medicare. So you do have a Medicare card still, but it sits dormant. You don't carry it, you don't use it. You paid into A and you're still going to pay into B. But again, you don't use your Medicare card. Whatever company you choose for Medicare Advantage becomes your Medicare card. So here you have some copays for doctors and or hospitals. So, and they're relatively small copays. Many of the companies, if you go to a primary care physician, it's a zero copay in many cases. And then if you go to a specialist, it can be, anywhere from $35 to $50 copay. Copays for the hospital also. When I had my surgery in January, I was in the hospital as an outpatient, and my insurance, I had a $350 copay for my outpatient surgery, total for the two doctors, the operating room, the anesthesia, any medications they gave me while I was in the hospital. My total copay was $350. And Medicare Advantage can include Part D. Now, this is perfect for people who say, I don't want to pay $40 a month because I'm not taking any prescriptions. If they go with a Medicare Advantage plan, then the prescription part is included with it and it just sits there dormant. And if they need it before the annual election period, they can use it. And if they want to change it come the annual election period, then they can change plans, Medicare Advantage plans, which changes your Part D. When it's funny because Part D came out in 2006, and back then there were 5 companies that offered prescription drug programs here in Maine. Well, I, as an independent license, I contracted with all 5 of those companies. Today there are 26 Part D programs available in the state of Maine. I don't license with not one of them. So if someone wants a standalone Part D plan, I can help them enroll in one. But most people are getting their Part D nowadays through a Medicare Advantage plan. And in this option, if your income is under 87,000 for this year, your approximate premium is the $148.50 that you pay for Part B, as in boy. So the difference between paying $400 and $148.50 for a lot of people is quite significant. So those are how the 4 parts of Medicare work. This is a fat-free Oreo cookie. And I just have it up there so that I can put my name and phone number on it in case someone has a question. A lot of people just use me as a resource. I currently have, well, if I count Fame now, 38 companies who will be handing out my business card to their employees who have questions about Medicare. The largest company that I have that hands out my card is LL Bean, and they've been handing out my card since 2009. And I don't really advertise my business. My advertising is done word of mouth. So people give my name to their family, friends, and coworkers who have questions, because everybody has questions when it comes to what to do with Medicare. And because I've been studying it for 20 years, I have a pretty good idea what's going on. And if I don't know the answer to the question, I have resources that most people don't even know about that I can. It's really funny because when somebody first enrolls in Medicare, they have to wait for their Medicare card to come in before they can get their Medicare number, which is needed to enroll in any form of insurance with Medicare. I can get their Medicare number before they can. I have access to that. So we found it very, very helpful, especially if someone, which some people tend to wait till the last minute to enroll. I've had people enroll like in the 3rd week of the month, and they needed coverage with Medicare for the upcoming month. And they've only got like 2 weeks, and they're not going to get their Medicare card before the 1st of the month. But I can get their Medicare number through the resources that I have available. So I'm going to take the presentation down off the screen. Hopefully you've been able to write my number down, or you can get it from Mary or Ethan. And I'm going to open it up to questions.
Giles, I have a question. You talked about HSAs and the limitations of contributing to an HSA while you're receiving Medicare.
Yes.
However, you can have assets in an HSA. You're no longer contributing, but perhaps you built it up over time when you were working, you retire, there's $5,000 sitting in the HSA, you're no longer contributing, but that doesn't limit your eligibility, correct?
That is absolutely correct. And people usually use their HSAs like to pay maybe a doctor copay or whatnot. Anything medical, your Part B premium, the $148.50, you can use your SSA to pay that also, because it's part of your medical insurance.
Yeah.
You're exactly right. You just
Yeah.
can no longer contribute.
Right, gotcha.
So I tell people to plan ahead. I get sometimes specific questions about HSAs. There are several different kinds of HSAs. So I usually tell people, if they ask me a question that's specific to their HSA, I say, talk to your accountant, because that's an accounting question. I don't pretend to be an accountant. I have my own accountant. So, but yeah, you're exactly right.
Okay, great.
Yep.
And I would just say from my own experience, because I helped my mother recently retired and went through the whole process. And having been through the process and being someone who, navigating financial forms isn't terribly daunting, but I would just say it wouldn't have been anything I would have done alone. We did see a counselor. We visited with the local area agency on aging. There was another counselor locally that we accessed. I found it to be very overwhelming and confusing, all the different parts, all the different details. And so whether somebody reaches out to you or whomever, I would just say, unless you have an experience with it, I don't know that I would ever try to navigate it alone. I found it to be really, once you kind of get through it the first time, I think you kind of wrap your brain around all of the elements of it and components, but I found it to be fairly confusing. So I'm glad that there are people out there like you, because I wouldn't have been able to figure it out, or at least I wouldn't have felt confident that I was helping her plan and set things up in a way that would, work for the remainder of her life. That's a big thing to do.
It's one of the reasons that I help people enroll in Parts A and B. I've had clients say to me, well, when I enrolled, or like a husband will say, when I enrolled a couple of years ago in A and B, it took me an hour on the computer or more. And I did one yesterday in 12 minutes.
Wow.
Because I know where to find things. I know
Right.
what needs to be filled in. I know what to click on. And it is a daunting process. But I want to caution you about one thing that you said. I actually have people from the Agency on Aging that will refer people to me.
Mm-hmm.
And the only thing I caution people when they go to those agencies is you have unlicensed people giving out insurance information.
Right.
I have an insurance license. I have to follow Medicare stringent regulations. Unfortunately, sometimes people get information from one of those agencies that is not accurate.
Right.
So I do
Absolutely.
caution people in going
Yep.
to unlicensed people to do
Yep.
that. So
The other advice I would give, and this is more about like once you're receiving Medicare, and
Yep.
it's probably specific to the provider that you choose, but I think, she's been really impressed. My mother's been really impressed with some of the added benefits. So a lot of health programs have, annual wellness credits, whether it's $200 a year that you get in wellness credits to purchase, gym memberships or Weight Watchers memberships or whatever. There's also a lot of freebies so that you can each month or each quarter, there's freebies that you can get online through online pharmacies. And so I would just say, if you have parents or you yourself are receiving benefits, and I think it's very comparable to standard traditional healthcare plans, just to be aware of all those extra incentives or benefits, those health related benefits, because they can be pretty sizable and help cover some of those other health related costs.
right, exactly. As a matter of fact, people are my age when go on to Medicare, they're looking to cover three basic things. Eyeglasses, my plan covers $400 towards eyeglasses. They're looking for dental benefits. My plan has a comprehensive dental program. It's included in the plan. And also the third one is hearing aids. And my plan covers hearing aids at a very low copay versus buying them outright. But you're right. My dad and I are on the same program, and our program paid us each $400 towards anything to do with exercise. I've got a couple of machines here in my house that rehabbed my knee with, elliptical machine and a recumbent bike, that were both, I got $400 towards each of those machines from my insurance company. And Dad and I just put $400 each towards a golf membership. And we're, we play 2-3 times a week, and we're playing at this, we've joined this club and things like skiing and yoga and martial arts. And I actually got asked the question yesterday, does your plan cover fencing? And I didn't know the answer to the question because I've never been asked it before, and it wasn't on the list. The people at the plan said, yes, fencing is covered. They want you to get up off the couch and get out and do moving. And so they'll reimburse you for that. Over the counter items, I get $50 a quarter of things over the counter, free stuff like bandages and pain medications and all these vitamins, supplements, through the local pharmacy. So these are, you're right, the extra benefits come with Medicare Advantage. They do not come with supplements. So
Right.
people who have supplements are wondering how all these people are getting these extra benefits, and it's Medicare Advantage. It really is.
Great. So there was a
So
question, Giles, Giles, I'm gonna call, I'm
that's
gonna
quite
get
all right.
that.
I get called all kinds of things.
I need to remember Eva Giles, because we have someone with that last name.
I tell people, remember Jay Giles?
Sure.
I'm Giles Jay.
That might help me.
Yeah.
That might help. So we had a question in the chat, and the question is, if you are working and have Part A now,
Yep.
when should you begin the process to enroll in the other programs prior to retirement?
That's a great question. I would say you probably should talk to me a couple of months in advance. The reason being is it's a whole different process once you have A to get B. There's 2 forms that Social Security hands out. One of them is an application for B. The second one is an employer verification of prior coverage, and your HR department fills it out. And I have people say, well, I've been all over Social Security's website and I can't find them. Well, I have the forms. So if somebody wants the forms to get filled out, I actually help people fill out the forms, the Part B application. But I can email you the forms, and I can, or drop them off or whatever, so that you don't have to go looking for them. You call me and I will get them to you. So yeah, but a couple of months in advance is usually a good time to start that type of thing. Let's
Okay,
see.
thank you.
Still subject to a prescription penalty. I didn't get the rest of the question.
Yeah, so if the question is, are you still subject to the prescription penalty if you don't sign up but are covered with group insurance?
No. The group insurance, and that's why the verification from your employer, your HR, is important, because that negates any possible penalty. Now, I want to make one other point. Usually when people go to enroll, they need an open enrollment period. So if you're new to Medicare, that's an open enrollment period. If you moved from another state, I'm meeting at 11 o'clock today with a couple who just moved from another state into Maine. That's an open enrollment period for them to enroll. If someone has Maine care, that's an open enrollment period, or loses Maine care, that's an open enrollment period. when someone is giving up group coverage, either voluntary or involuntary, that's an open enrollment period. If there's a plan out there, and there are plans out there that I represent that have a 5-star rating from Medicare, you can enroll in that plan 12 months of the year. I've got 9 people that I've enrolled since December in a plan, one of my plans that only had Medicare, and they didn't have an open enrollment period other than the 5-star rating. So people are under the misconception that they have to wait till the annual election period. And that's not always the case. That's when people want to give me a call so we can discuss this. Because everybody's situation is different. Any other questions?
Roxanne, you're muted if you're,
Sorry.
that's okay.
Will the presentation be available in hard copy?
Today's presentation, I believe, was recorded, so Mary will be taking care of that.
I think what
Okay.
she's wondering if we can have a PDF or an email of the actual slides.
Oh,
Yes.
absolutely.
That'd be great. If
Yes.
you wanted to send that to Ethan or I, that would be great. And we can share that with
I will
staff.
definitely email that to Ethan, because I know I have Ethan's email.
Great.
Yep, I can get that out to everybody.
That'd be perfect. Thank you very
Sure.
much.
Absolutely. I try to keep it simple because then it doesn't seem, as overwhelming, complicated.
Any other questions? We have a few more minutes. Now's your chance. You've got a expert at your
Yeah, and
service.
if people have individual questions that they prefer not to ask in a group setting like this, feel free to call me, text me, and/or email me.
Great.
So I do have one other question.
Yep.
Do you have any suggestions for, let's say, somebody who is close to retirement and that isn't eligible for Medicare but needs insurance?
Yes. As a matter of fact, to answer that question, in 2018, LL Bean had a voluntary early retirement. So they had people who met certain qualifications who could retire, and they had to be over 55 and have had 20 years of service with the company. Many of those people were under 65. And when they offered a voluntary early retirement book that they handed out, and my name was in there under insurance and under Medicare. So I met with 200 of those people in 2018. That was probably one of my busiest years. Many of them, like I said, were pre-65, and HR called me at one point and said, Giles, they actually set me up in an office in their building. And every hour I had a different person sitting in front of me because I needed to meet with so many people. They said, what, Giles, why are you meeting with people who are not Medicare eligible? Because that's really all I do is Medicare. And I said, because these people have insurance decisions to make. And even though they're pre-Medicare, I can help them make the decisions. And I have resources. I have people I network with who do non-Medicare insurance for health insurance for people just like that. So if you've got somebody who wants more information about that, contact me. I'd be more than willing to share my contacts because see, I run into a lot of people. The husband might be a little older. He's going on Medicare. They both retired, but the wife still has another 6 months. I actually had a case at LL Bean where I saved someone 2 months premium because they were going to choose Cobra. Now, your HR people will be familiar with this, but Cobra, the company, when your retirement date, they would lose their insurance. They have 30 days, the company does, to get them the paperwork for Cobra.
Mhm.
They had another 30 days to get the paperwork back to the company. So that's 60 days. Well, at the end of the 60 days, the person was eligible for Medicare. So they said, should I pay my COBRA for those 2 months? And I said, if you have a claim, yes. But if you don't have a claim during those 2 months, why would you pay premiums for 2 months? And the person couldn't believe that these are things that I have dealt with and know is helpful to people. I mean, 2 months worth of COBRA premiums is a lot of money for most people.
Yeah.
And I have about 150 clients at LL Bean who've been on Medicare and still working full time at Beans. And some of them have been working for 4 or 5 years. They've been off LL Bean's coverage because they found that they can get better coverage, because most companies' insurances have deductibles, some of them quite high. When you go into Medicare, like if you go with Medicare Advantage, the deductible is 0. There is no deductible. So if someone's paying, so much for their group insurance and they can pay less or about the same for Medicare and eliminate their deductible. I mean, I had a client about a month ago who told me that he would spend 4 or 5 days in the hospital and he met his $5,000 deductible. So it's, that's an important factor to consider when you're looking at it. So someone doesn't have to be retiring to go on to Medicare. That's my point.
Okay. Thank you very much.
Yeah, you're welcome. Any other questions? Well, I appreciate all your time today. And like I said, if you've got future questions, you can call me, you can text me, you can email me, or I'm sure Mary and Ethan can get a hold of me if they have, if anyone has questions. And so that ends our presentation today.
Thank you so much, Giles. Thank you for everyone for joining.
You're very
And
welcome.
we appreciate your time. I hope this was helpful, and at least you know who to reach out to for more questions. So thank you so much.
Oh, one last thing. I had someone ask me the other day when I was going to retire, because I'm 65 now. And LL Bean was actually concerned about when I was going to retire. And I say to them, I work 3 to 5 hours a week. Why would I retire?
Yeah.
And
Yeah.
my son, who's here, is actually studying for his insurance license so that I can teach him to do what I do. So we'll always have, Bay Park Senior Insurance will always have someone that people can rely on.
Great. That's awesome.
Yep.
Wonderful.
Excellent.
Well, thank you so much. Have a great Friday and a great weekend, everyone.
Yep, you too. Thank you.